This is a demonstration of Allscripts MyWay for urgent care. Today we're going to demonstrate how Allscripts MyWay can overcome your daily challenges and help you achieve meaningful use. In urgent care practices, most providers are challenged with walk-in scheduling, when to refer patients to the ER, similar diagnoses that are seen daily, and the ability to record all the medications a patient is currently using. Allscripts MyWay can help make your life a lot easier with a scheduler that allows for quick appointment scheduling with minimal information, clinical decision support guidelines to assist in triage to the emergency room, common problem palettes, and medication reconciliation. Now let's take a look at how Allscripts MyWay can help meet your needs. Allscripts MyWay is a completely integrated practice management electronic medical records application. That means you can tell who is scheduled for the day, what their last visit note looks like, and what their balance is, all on the same database. Allscripts MyWay is a hosted application. You have instant access to your patient's information, automatic upgrades to your database, and no server maintenance. On the screen, you see the desktop. This desktop can be customized to the user based on their role within the practice. On the left are the appointments that are scheduled today. On the top right is your message center where you can see both internal and external messages. To the bottom right, you see the notes that the provider has started, but these still need additional documentation. To schedule an appointment, click on the blue calendar hyperlink, which takes you to the scheduler window. You can look at a one-day view or workweek view. Your day can be templated using appropriate appointment types, colors, and durations, or it could be more wide open, as you see in the afternoon. To schedule an appointment, click on any open slot and then choose the patient's information, either by last name, first name, social security number, phone number, or birth date. In this case, you're going to go ahead and document for Donna Dobson. In the Reason section, you say that she is coming in today for a sore throat. Once you select OK, Donna is now on your appointment calendar. You can also overbook appointments depending on your security permissions by selecting the open slot to the right of the scheduled appointment. When Donna arrives, the front desk is going to click on the time and update the status from Scheduled to Checked In. You go to the Account tab, and from the patient's demographics, Allscripts MyWay is automatically going to pull forward what the patient's copay amounts are. In this case, it indicates that the patient has a $20 copay. They paid by check. You enter the check number, and you can even select Print Payment Receipt and hand them the receipt. At the bottom, you see any prior balances. You can go ahead and add a prior balance. Anything you add as a visit payment would automatically allocate to the patient's E&M or visit line item for today. Anything you post at the bottom would allocate to the patient's oldest balance. This assists the billing department in having to allocate funds at the end of the day. The front desk is also responsible for verifying the patient's demographics. You can do this by selecting Patient Information and verifying that there has been no change in the address, the phone number, the insurance, and the pharmacy for this patient. As long as nothing has changed, you can go ahead and select OK. Your patient is now changed to Checked In and is time-stamped at 10:22 a.m. This indicates to the nurse that the patient is ready to be taken back. The nurse then selects Open and Create Note and starts a brand new chart note for the patient. You can manually key in all the vitals for this patient or select Welch-Allyn Spot vital signs, and Allscripts MyWay will automatically input all the vitals in the appropriate sections. Under Chief Complaint, you have a list of appropriate systems and symptoms. Your patient is presenting today for sore throat. You can go to the ENT system and select sore throat as the symptom. If you wish to add a symptom not already on your list, you can then modify your list of symptoms by clicking the blue hyperlink and adding new symptoms to your list. You can also remove items or hide them by putting check marks next to any of those symptoms or systems that you don't use. Furthermore, you can reorganize your list by using the up or down arrows, or click A to Z to list them in alphabetical order. Anytime you modify your content, you're modifying it for your entire patient base. Each provider can modify their own lists, or you can have lists for the entire practice. Once you click Close, it makes the appropriate changes. As the nurse moves to the HPI, it's now going to guide you through an appropriate list of questions and responses based on the chief complaint you selected. Under Sore Throat, it asks where the sore throat is located. You say on both sides, and then describe that it's a scratchy and sharp pain. It began 3 days ago. At the bottom of the window, you are also going to see a total number of points that you have charted. This is important in order to calculate your level of E&M code based on your documentation. Once finished with your HPI, the nurse can move to the History section. The History section will always pull forward from the patient's last visit. In this case, you identify if any of the information has changed. The patient can also add information to their history sections through the patient portal, using a unique username and password. To review this information, you select the appropriate items and review for any changes. As long as you've made no changes, you can put a check mark next to the medical history. It adds a statement to the note that you have reviewed the medical history with the patient and gives you the appropriate number of points towards your E&M coding. There are no exceptions or changes to this particular item, but you're still obtaining points by just putting in a check mark. You can select the relationships and any appropriate diseases for medical, family, surgical, and social histories. You also have clinical decision support guidelines that are requirements for meaningful use. Based on the items that you selected, the clinical decision support guides tell you that you need to add a tobacco history in order to pass. You go ahead and note that your patient is not a smoker. It then removes that rule from your list as it has been completed. If your patient currently smokes, it would indicate that there are additional questions and responses that you need to enter. You then use the drop-down windows to identify any medications or services for tobacco cessation counseling, as well as any educational materials that you have given the patient. In the Medication History section, you have all the appropriate medications that this patient is currently on that have been prescribed by the provider. On the right-hand side, you see any retrieved medications. These are from all outside providers. You obtain this information through the patient's pharmacy benefits manager. This pulls the patient's appropriate formulary forward, so as you go to write prescriptions, it would let you know if this is on their formulary list or if you should select an alternative medication. Under Food and Drug Allergies, you simply choose the allergy and the appropriate reaction. Once the nurse finishes the history section, they can go ahead and save the note and then exit out, taking them back to the main window. They update the status of the patient from checked in to Exam Room 1, letting the provider know that this patient is now ready to be seen by the provider. The provider has two options. They can jump straight into the note by clicking the same icon that the nurse did to begin the chart note, or they can select one-page summary, in which they see a summarization of this patient's record. The one-page summary is built based on the provider's options. In this case, it pulls forward a picture of the patient, what their current medications are, their active problems, their results, and then a copy of the visit note as it appears thus far. Everything the nurse noted is pulled forward in more of a paragraph and sentence structure. Donna is presenting with a sore throat on both sides, described as scratchy, sharp, and it began 3 days ago. Allscripts MyWay pulls forward any of the history that the nurse has reviewed with the patient as well. Once you review these results, you can go ahead and select the date, and it takes you straight into the chart note where the nurse left off. The provider can begin in the HPI section by adding additional information that the nurse left off, or the provider could build the entire HPI themselves. In the Review of Systems section, you can build group norms so that you can easily select one checkbox, and it will pull forward a group norm exam. In this case, the provider indicated that the patient denies any fever, chills, fatigue, weight loss, or weight gain. You did an entire bodily review of systems. You can once again select any of the appropriate systems and see the symptoms that you reviewed with the patient. These are built during implementation. If everything was normal, except the patient recently noticed fatigue, you can move that from the No column to the Yes column. At the bottom, you have charted 14 points toward the review of systems. You can now move to the physical exam. The physical exam works very similarly. Select one checkbox, and it pulls forward a group norm review of systems, and then you just chart any exceptions. In this case, you can go to the ENT, select oral cavity, pharynx, and larynx, and note in the posterior pharynx that it was cobblestoned. Once again, this comes pre-built with appropriate systems, findings, and descriptions, with a blue hyperlink above each column giving you the ability to add your own content. If you choose to not chart based on the point-and-click options as described, you can come into the Note section and type your exam. You can also use Dragon or voice recognition software, or create macros and quick notes so that rather than selecting the check marks below, you can pull an entire sentence or paragraph forward by just selecting that item. When you move to the Diagnosis section, you have Donna's list, and it would pull forward everything you've ever diagnosed Donna with in the past. You can then look at frequently used diagnoses. You can also create quick categories, an easy way to access specific diagnoses. You can go into the search window and type a description or an ICD-9 code. Once you select your diagnosis, it's going to build a common problem palette. It builds all the appropriate responses from this point forward as you add to this diagnosis. Moving to the RX screen. To write a prescription, you just type the prescription in the drug section. Once you select Search, it will pull up that particular medication with all the appropriate strengths. You can choose the strength that you would like to select, and it will do a drug-to-drug interaction based on the medications that your patient is currently taking, their allergies, and medical history. In this case, it tells you the patient is already on Zithromax, and erythromycin would be duplication in therapy. You can go ahead and select Yes to continue or No if you would like to select a different medication. At the bottom, you choose your SIG by selecting 1 tablet, PO, BID for 10 days, and it would automatically calculate your quantity. Allscripts MyWay now ties this specific medication to that diagnosis. You can also use your dosing suggestions section, and based on your patient's diagnosis, it would give you an appropriate list of alternatives as well as how to use this medication, similar to a PDR. Once you choose OK, your prescription is now attached to the patient's record. In the Services Performed section, you can select what services you are going to render today. These would be your CPT codes. You select Donna's list and look at the items that you have done for Donna in the past. Your frequently used orders, which is a copy of the top 50 CPT codes for this particular provider, and then you put them into specific categories. For example, you can see all of your established patient procedures, your new patients, office procedures, office surgery, labs, immunizations, injections, and supplies. You can group them into particular categories for easy selection. Once you select a CPT code, it's going to tie that back to your diagnosis of strep throat for future reference. In the Services Ordered section, you can select any outside services, things that you're not going to bill the patient for, including any radiology or labs. Once you select the laboratory and you close your note, the lab would automatically be sent to the appropriate lab using an HL7 interface. The results would be returned back into your Messages section. The Plan section is where you can identify when you want your patient to come back or list any exercise, diet, or patient instructions. Everything you add to these 4 tabs is automatically applied to your patient's diagnosis. The next time you diagnose the patient with strep throat, it will show you these are the prescriptions that you've written in the past. These are the services that you like to perform. These are the things that you order. And this is when you want to have your patient return. In this case, you can do a quick strep, order a CBC, have them come back in 2 weeks, and give them instructions on strep throat. On the right-hand side, you also have access to health maintenance rules. These health maintenance rules are built based on a patient's age, gender, and medical history, letting you know if there are any items that are due for this particular patient. For example, pap smears, mammograms, colonoscopies, flu shots, and depression screenings. You see when the patient is due for this particular item. When you perform this service, you select Action, and you add it to your Services Performed and bill the patient for today. Anytime you add an item that has a procedure note attached, Allscripts MyWay will prompt you to answer additional questions based on your selection. In this case, for your patient's vaccine, it's going to make sure you give them a vaccine information sheet. Record the time that it was given, the dosage, the units, the funding, the route, the site, manufacturer, lot number, and of course any notes or who gave the injection. This is called a procedure note. These procedure notes are attached to CPT codes and allow you to create specific notes for a given procedure. Once you select OK, it adds that note to today's date of service. Allscripts MyWay also comes pre-built with diagrams and images. You can select New, and you can look at all the images that come pre-built with Allscripts MyWay, and you can also add your own. In this case, you pull up the patient's throat, and using the colors at the top, you can annotate on this image and save it as a part of their record. You can also add all of your own images. This is very useful for consent forms. If there is a consent form, such as an ABN, you can attach it, give the patient the pen tablet, and they can easily sign off on the form and save it as a part of their record today. Once you're finished with your note, you select Close Note. It will remind you if there are any clinical decision support rules that you need to complete in order to meet meaningful use. You can then document whether your note is incomplete. When you leave it as incomplete, it saves the note in that section, so you can easily add additional documentation at a later time. If it is complete, it's now going to forward your prescriptions to the pharmacy. Your super bill will be sent to the billing department, and your appointment status is updated to Ready to Discharge. If you've missed your E&M code, it prompts you to add it, and then based on your documentation, Allscripts MyWay gives you a suggested code. In this case, it's going to suggest a 99213. You can confirm a level of 3 or upcode to a 4 or 5. Allscripts MyWay lets the user know that it's going to send this prescription to the patient's selected pharmacy, Walmart. Once you select OK, it takes you back to your main window. The status is updated from Exam Room 1 to Ready to Discharge, indicating to the checkout person that this patient is on their way out the door. The checkout person selects the checkout icon, posts any additional payments or co-insurances that were made, prints out any specific items, selects Generate Documents, and creates mail merge documents using Microsoft Word. All the information from today's date of service is completed within the patient note. In this case, it pulls forward Donna Dobson, her date of birth, and the patient's physical exam. You can pull in the entire physical exam, or you could have just pulled forward the abnormal exam, lessening the length of the note. It pulls your impression, what your plan is, and then it can be electronically signed off by the provider. Because you're in Microsoft Word, you can annotate and type on this image and save it as a part of the record as well. Once you exit out, it asks you if you would like to save a copy of this. You can also create missed appointment letters, as well as return to work and school forms from the document generation feature. The front desk is then prompted on when you need to have the patient return. You select the 2-week icon, and it will take you forward 2 weeks into your calendar to schedule that appointment. Allscripts MyWay will list any future appointments that have already been scheduled, as well as any referrals that have been made to outside sources. Once the front desk clicks OK, Donna Dobson is updated, discharged, and timestamped. When Donna Dobson returns in a few weeks for a follow-up on her sore throat, instead of starting from scratch, the nurse will select the follow-up icon, choose the date of service to follow up from, and then simply add the sections of the note that she would like to copy. You can select all and copy your entire note from one date of service to the next, or more commonly, choose the chief complaint, the physical exam, and the diagnosis. If the symptoms have improved, you can select the arrow up. It will pull forward the appropriate symptom and in the note section, add the word improved. If the symptoms have worsened, you can select the arrow pointing down, and it pulls everything forward as worsened. Or if you wanted to simply pull one date of service to the next, you can select the arrow to the right, and it does not add anything in the note section. This is a great way to pull your chronic conditions, such as diabetes or hypertension, from one date of service to the next and not start from scratch. You can then go in and update any information for today's visit that was different than the previous visit. You have your own chief complaint, your HPI as it was on that date of service, your physical exam, and your diagnosis is here as well. Exiting out and going back to the main desktop, you'll see the message center at the top right. To create an internal message, you select New Message and New Call. You add the patient's name, who you need to send this message to, and then in the Reason field, type your message. Once you type your message, it appears in the user's inbox. You can select Phone Messages, open the message, and the user can add additional information. In this case, you said that the patient was having a reaction to their medication, and they stopped using their erythromycin. You select Add Note and say to go ahead and schedule an appointment. Using these macros or quick sentences, it enables you to quickly respond to a message rather than having to free text and type a lot of information. Once you have your information here, you go ahead and select OK, and your message is completed. Within your message window, you have access to all the pieces of the note that you need. You have access to Donna Dobson's one-page summary. You have the ability to review past notes, where you can look at all of your patient's previous notes. You have your result tracking, in which you can easily look at your patient's previous results over time. You can also look at any growth charts from your pediatric patients, graph observations, and then further release of information. If you need to send the patient to another provider, this icon allows you to create the information that you would like to be forwarded using the Allscripts referral network. You determine what items you want to select and what attachment you want to include. In this case, you want to include the throat diagram and chart note. You select Preview to see what you're about to send out. Then you can export, print, or save your summary. This is a copy of what your summary looks like. If the provider you're referring the patient to is an Allscripts provider, it will come into their system as discrete data, meaning the problems will be associated with the appropriate diagnoses and medical history section. The allergies would be pulled forward into the appropriate allergy section, and the procedures will be pulled in appropriately as well. If the provider that you are forwarding to is not an Allscripts provider, This image is just received as you see on the screen. They would then attach it to the patient's record or print it out and attach it in their patient's paper chart. Going back to your main desktop, you see that you have refill requests. Currently, a lot of refill requests are received by fax. Once you go live with Allscripts MyWay, all of these would be coming into your system electronically through the message center. You can also fill these internally by going to New Message and RX Refill and send a refill request to a provider. From time to time, patients will present with paper documentation, faxes, or mail correspondence that needs to be scanned into the patient's record. You can scan these pieces of information into the patient's record and then forward it to the provider for approval. It will appear in the provider's message center. They can open the image and review it, add additional notes or documentation, and then select Approve Attachments to have them signed off into the patient's record. Health maintenance alerts are based on the patient's gender, age, medical history, and medication history. You can review how many patients have health maintenance alerts and also have this forwarded to a specific user that's responsible for calling these patients to remind them of specific appointment types. Reports are also very important. You have both clinical and financial reports. You can run any of these reports, for example, identifying all of the patients that you have diagnosed with strep throat over the last year. By selecting View, it gives you all the patients' names, visit dates, addresses, and phone numbers. You can always export files out to Excel or PDF. You can also schedule specific reports to automatically run and be sent to your inbox. You do that by selecting Save As, deciding when to schedule the report and who to send it to. You will send this to all administrators every day at a specific time. Therefore, it will automatically be generated and sent to your inbox for review. Under Stimulus Report, you have all 25 stimulus and meaningful use criteria, the description, what percentage you need to meet, and where you currently stand. The first one you see is the allergy list. It tells you that you need to have either no known allergies or at least one medication allergy indicated, and you need to meet this requirement 80% of the time. You have seen 12 patients, and you've done this appropriately for 9, resulting in a score of 75%. At this point, you would not want to attest. You need to have fewer than 5 failures in order to attest on the ONC website for stimulus funding. These are your meaningful use criteria. You also have the clinical quality reporting initiatives in which you can select the core requirements and then any alternative core that you have selected. You click View, and you can look at your patient's numerator and denominator. You have seen 6 patients, of which you have appropriately documented 5 blood pressures for hypertension patients, giving you a result of 83.3%. Additional reporting tools for financial reports would also be available on this window for the provider as well. Most commonly, the financial summary. In this case, you can look at what your total charges, receipts, and AR were for the day. You can once again have this report automatically generated and sent to your inbox every single day. Selecting Close, you return back to your main desktop. Allscripts MyWay not only addresses your daily challenges, but also connects you to 180,000 physician users, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country, the Allscripts Referral Network, to patients through the patient portal, to patients' charts remotely, with Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/myway.